All right. Welcome back, everyone, to the Health Hub, a podcast brought to you by Oliver Chiropractic Wellness Clinic.
Yes, welcome.
And today we're diving deep into something that honestly might sound kind of scary at first.
Oh, what's that?
Degenerative disc disease.
Ooh, that does sound a bit scary, yeah.
Yeah, it's got that disease in the
Yeah.
name, right?
Yeah,
But it's something we should all understand a little better.
I think so too. It's
Yeah,
more common than people might think.
exactly. And that's why we've got you here, an expert from Oliver Chiropractic, to break it all down for us.
Happy to be here.
So let's jump right in. Like, when we hear degenerative disc disease, it sounds pretty intense.
It does.
Could you maybe just explain what's actually happening in our spines?
Absolutely. So, you know those discs in your spine? They're kind of like little cushions, right? They sit between each vertebra. They act like shock absorbers for your back.
Oh, okay, like little cushions.
Exactly, yeah. But over time, just like anything else in our bodies, these discs can wear down.
Makes sense.
That's the essence of degenerative disc disease. It's that gradual breakdown of those cushions.
So it's kind of like, how our knees might start to ache as we get older, just natural wear and tear.
Yeah, I think that's a great analogy. And you're right, it is a natural part of aging. But the thing is, not everyone with disky degeneration actually experiences pain or really severe symptoms.
Oh, really?
Yeah, and there are definitely things that we can do to kind of help manage and even slow down that wear and tear.
Well, that's good to hear. So I understand there are like 4 stages of degenerative disc disease.
Yes.
Can we maybe just walk through what happens in each one?
For sure.
I'm particularly curious about those like early stages since you said not everyone feels pain right away.
Absolutely. So stage one is often, pretty much silent. You might not even notice any symptoms.
Oh, wow.
But subtle changes are happening, like your spine losing a bit of its natural curve. And here's where it gets interesting. Even without pain, that extra pressure on your spine at this early stage can really speed up the wear and tear process.
Oh, that's interesting. So even if we're feeling fine, those early changes are kind of setting us up for bigger problems down the road.
Exactly. That's why early detection is so important. Now, moving on to stage two, things become a bit more noticeable. The discs start to thin out even more, and you might see bone spurs developing. Imagine your spinal cord like a highway,
Okay.
and the nerves are the cars. In stage two, that highway starts to get narrower, which causes traffic jams, and those are basically the pain signals that you start feeling.
That's such a good visual. So stage 2 is when that like nagging back pain might start to kind of creep in.
Exactly. Now, in stage three, the postural changes become more obvious. You might notice you're slouching more or having trouble standing up straight. The pain intensifies and it starts to really interfere with your daily activities.
Yeah.
Unfortunately, at this stage, nerve damage also becomes a real concern.
Oh, wow. So it really starts to impact your quality of life at this point.
Yes, definitely.
What about the final stage?
Stage four is the most advanced, and it's often irreversible, unfortunately. The discs are extremely thin or might even be completely gone. The spine loses most of its flexibility, the pain is significant, and there's a higher risk of serious nerve damage. In some cases, the bones in the spine can even fuse together.
Okay. So if we're noticing back pain or any of those early signs, what can we do? I mean, is there any way to like manage it or even slow things down?
Absolutely. So while we can't completely stop the aging process,
Right.
there's a lot we can do to manage the symptoms and slow down the progression.
Okay.
And that's where chiropractic care can really come in.
Let's talk about that. So I know at Oliver Chiropractic, you took a really gentle and non-invasive approach.
We do.
How exactly can that kind of care help with degenerative disc disease?
Well, one of our key tools is chiropractic adjustments.
Yeah.
These adjustments help restore the proper alignment of your spine, which takes pressure off those discs and the surrounding nerves. It's a bit like, realigning a crooked picture frame so it hangs straight and doesn't put all that stress on the wall.
Makes sense.
So by restoring that alignment, we can reduce pain and potentially even slow down the progression of the disease.
So you're not just masking the pain, you're actually addressing the like root of the problem.
Exactly.
I like that.
Another technique we use is spinal decompression therapy. This is like giving your spine a gentle stretch.
Oh.
And it creates more space between the vertebrae. That extra space allows better blood flow and promotes healing in those discs.
So you're helping the body kind of heal itself by creating a better environment for those discs.
Precisely. And we've seen amazing results combining spinal decompression with chiropractic adjustments.
Oh, wow.
They work beautifully together to provide relief and improve your overall spinal health.
This has been so insightful. I think the biggest takeaway for me and hopefully for our listeners, is that we don't have to just accept back pain as an inevitable part of getting older. There are things we can do,
Yeah.
even if we're not feeling pain yet.
You're absolutely right. Early intervention is key. The sooner we can detect and address any spinal issues, the better the outcome.
100%. Well, thank you so much for breaking all of this down for us.
It's been my pleasure.
For our listeners in the Edmonton area, if you're experiencing back pain or just want to be proactive about your spinal health, I highly recommend reaching out to Oliver Chiropractic Wellness Clinic. You can give them a call at 780-455-2112 to book a free consultation and discuss your concerns and learn more about how they can help you on your journey to a healthier, pain-free life. And as we wrap up, I'll leave you with this thought. What's one small change you can make today to show your spine a little love? Until next time, be well.
Be well.